So there's a small, but not zero, risk of stroke related to this procedure. We can also damage tissue that sits near the heart. So it's often said that nature abhors a vacuum. It's nowhere more true than with regard to human anatomy. So the heart is surrounded by organs tightly packed in there in the chest. And there are a couple of organs nearby that, if damaged, can cause some mayhem. One is your food pipe, we call the esophagus, sits right behind the heart. Damaging that can be very problematic. And then there are nerves that pass near the heart on their way to the diaphragm, which are the muscles that cause your lungs to billow in and out. Damaging those nerves would damage that function and will cause some problems with breathing. For patients that we would typically select for catheter ablation, from a single procedure about a year later, somewhere in the range of 7 out of 10 people will be free of atrial fibrillation, which means that 3 out of 10 will continue to have atrial fibrillation, maybe less than before, never more than before. But it is not a given that if you have this procedure, you will be cured of your atrial fibrillation. The principal goal is quality of life. Stroke is an issue as well, obviously, but we have other ways of dealing with stroke, for example, medicines. So we really focus in on, does it make you feel better? As physicians, we should be laser focused on 2 things, living longer or living better. This is not a living longer issue, happily. It's principally a living better issue.